my name is Ran, and today we're going to talk about dementia and Alzheimer's disease. Dementia is the dysfunction or loss of memory, attention, orientation, language, judgment, and reasoning. 20% of the dementia are caused by vascular disease, such as strokes. It's either be single or multiple times. And Alzheimer's disease account for 60 to 80% of the dementia, and less than 10% are caused by Parkinson's disease. Alzheimer's disease is a progressive chronic condition, and it's not curable or preventable. And in regards of age, 11% of people over age 65 are having Alzheimer's disease, and 1/3 of people over age 85 are having Alzheimer's disease. In gender, women are generally higher risk than men because they're generally living longer than men. And African Americans, Hispanic Americans are slightly more likely to develop Alzheimer's disease than whites. And aging is the greatest factor to develop the disease. If you have first-degree relatives in your family, you're more likely to have Alzheimer's disease or dementia. And according to World Health Organization, China's sub-Saharan African have higher incidence compared to the other countries, according to the study in 2009. And 67% of the cases of dementia and Alzheimer's disease are from low to middle income countries, and 37% are from high income countries. Population aging is the main drive to increase the numbers of cases, and they predicted there's another bulk increase of cases occur in 2050.
Bowen, and I'm going to go over some statistics about Alzheimer's in Texas. So in Texas, Alzheimer's is like number 4 in Texas on an Alzheimer's case, and the second death in Alzheimer's in Texas. So every 66 seconds, a new person diagnosed with Alzheimer's, and usually it's like older people. In Texas, it's cost about like $2.5 billion in Medicaid to care for a patient with Alzheimer's, and that's like half the money of the Medicaid cost like Texas got. And Alzheimer's is like the 6th leading cause of death in Texas, and it increased like more than 100% since 2000. And that rate like on 100,000 cases is 6,772 people. And when you saw the patient with Alzheimer's, you're gonna see some signs and symptoms like clinical manifestation. The first one is memory loss. That's effective child skill, and it's not just regular memory loss, but they go beyond forgetting assignment, deadline, name, and their college phone number, even their family member. The second one is difficult, like performing familiar tests, like forgetting tests that they have done, like just regular tests, like day in, day out. Number 3 is problem with language. They forget in word, and they can just use like make up word similar like aphasia, dysphasia, and expression with talking and reading. Number 4 is disorientation to time and place. They can lose track of time and they don't know what time they're in, where they've been. They can just wandering around. Number 5 is poor with degrees or judgment. That's meaning like they can dress inappropriately, like for the season, like they can wear sweater on a hot day. Number 6 is problem with abstract thinking. They cannot do math problem, something simple like that. Number 7 is misplaced thing. Alzheimer's patient, they can put things belong to them like wherever, and they cannot find it, or they cannot like track it down. Number 8, changing mood and behavior, and it's like rapid mood swing. They can be sad, they can be happy, and they can like act like a child. And number 9 is changing personality. They have become confused, suspicious, depression, or usually they feel fearful and anxiety. And number 10 is a loss of initiative. So people with Alzheimer's, they just sit there and just staring at the air and nothing. They don't feel like doing nothing, and they don't even know what to do. So some of the risk factors for Alzheimer's patient was like the greatest one is aging. So the only people who have a higher chance to get Alzheimer's, but it's not the definite like cause for Alzheimer's disease to happen. The second one is usually diagnosed with like patient, one of your family member have Alzheimer, and usually that's your mom, your grandparent, like that. You're usually gonna get the gene from that person. The other factors like health, like for other health factors, brain, heart injury, trauma, heart disease, diabetes, stroke, and high blood pressure and high cholesterol. These things can be modified accordingly to your lifestyle, so it's gonna decrease the chance of you getting Alzheimer's disease. Thank you.
Hi, my name is Elinor. The diagnostic test for dementia Alzheimer's. There is no one test to determine if someone has dementia Alzheimer's. The doctors cannot diagnose dementia Alzheimer's until after the death of the person, and then they do an autopsy. However, they can predict if someone has dementia Alzheimer's based on the following examination. It could be through the medical history of physical and neurological examination, mental status examination, characteristics of the patient thinking, and then the day-to-day functioning of the person. Complications of dementia Alzheimer's. As the disease progresses, it leads to agitation and aggression. You may see someone with dementia Alzheimer's act anxious or upset. They may feel this way and then shout at people or throw things or try to hit people. Another complication is fall. Usually they lose their coordination and balance and tend to fall, and when they fall, it worsens the disease. But towards the end stage of Alzheimer's dementia, it may lead to more complications due to immobility, and these complications are like bed sore, muscle contractures, infections, and some of the most common infections are UTI, flu, and pneumonia. Other complications could be depression because they feel isolated, and then they tend to wander a lot, and then they could get missing. So it's advisable they wear like a med bracelet. And then malnutrition and dehydration, because most often they forget to eat, or they won't even know they're hungry, or to drink water. Then, is Alzheimer's dementia contagious? No. But however, the caregivers of the people taking care of someone with Alzheimer's dementia may be faced with responsibilities and then have emotions, and some of the emotions could be anger, guilt, and it can also affect them physically and affect their financial well-being. So for more information, you could check out this website. Thank you for watching me.
Hi, my name is Natalie, and today I'm going to be talking about prevention strategies for Alzheimer's disease, dementia. So in reality, there is no real prevention or cure, but there are things you can do to keep our minds healthy. So number 1, avoid harmful substances, smoking or alcohol. Number 2, challenge your mind, crossword puzzles, things like that. Number 3, exercise regularly, like walking in the park or around the neighborhood. Number 4, stay socially active. Number 5, avoid trauma to the brain, just practice safety basically. Number 6, take care of mental health. Number 7, treat diabetes. Number 8, take care of your heart. Number 9, get enough sleep. And number 10, get the right fuel. Try to eat healthy. Then stop. Go. The goal for treating Alzheimer's would be to treat the symptoms, slow down progression, and support the patient. This will include behavioral modification, practicing moderate exercise, assistance with functional independence, providing assistance and support for caregiver, and also drug therapy for cognitive problems. These problems include decreased memory and cognition. We can use cholinesterase inhibitors, which will be Aricept and donepezil. We can use NMDA receptor antagonists, which an example would be Namenda, which is memantine. We can also be treating depression if the patient is suffering from depression. We can use SSRIs. An example would be Zoloft, which is sertraline. And then a typical antidepressant, which will be Remeron, which is mirtazapine or trazodone. We can, if the patient is suffering from agitation, physical aggression, or disinhibition, we can use antipsychotics. An example would be Halidol, which is haloperidol. And we can also use benzodiazepines. An example would be Ativan, which is lorazepam, or clonopin, which is clonazepam. If the patient has trouble sleeping, zolpidem, which is Ambien, is usually used. And in regards to financial burden to the patient, family, and society, according to the Alzheimer's Association, it is important to start exploring our finances and future care. It is also important to gather important documents, and it's important to consider to get help from well-qualified financial and legal advisors. So estimate possible costs, look at all insurance options, and consider work-related salary or benefits and personal property as potential income. You can also explore if you can qualify for government programs, which include Medicaid or Medicare. And for number 8, learn about income tax breaks for which you may qualify. And for financial assistance, you can start exploring any assistance that you can qualify for. And make sure to take advantage of low cost and free community service.
Hi, my name is Sandy, and I will be talking about services for care, support resources for individuals and family, and emotional and spiritual effect of Alzheimer's disease and dementia. There are a variety of facilities and services. And the first service is residential care, and it includes retirement homes, which are suited for individuals at the earlier stages with Alzheimer's, assisted living, which bridge the gap between nursing homes and living independently. And then we have nursing homes, which provide round-the-clock care, Alzheimer's special care units, which are also called memory care, continuing care retirement communities. And then we have the other option of in-home health care. And these two services are long-term care, while adult daycare and hospice care are more short-term care. And these facilities and services can be found all over Houston. Depending on your choice of facility, costs can cost as high as $70,000 a year. So that's why we have support resources for individuals and family. And they provide an atmosphere of understanding because they completely understand what the caregivers are going through. It's very stressful. And they can also give current information about the disease itself, as well as topics relating to legal, ethical, and financial issues. Their Caregiver Resource Center, Alzheimer's Association, Caring for a Person with Alzheimer's Disease, Your Easy to Use Guide. These are the websites that you can use. They offer many educational and support systems available to help family caregivers. As for emotional and spiritual effect, caregivers would describe it as very stressful. These caregivers also exhibit adverse consequences relating to their own emotional and physical health, and the consequences can be very devastating for both the patient and the family. As for spiritual effect, Alzheimer's disease can rob a person of independence and self-esteem, which can lead to depression, anxiety, and loneliness. Personal faith, prayer, connection to church, and family support enhances their ability to keep a positive attitude. However, Alzheimer's disease and other dementia can start neglecting their faith. So what we want to do is encourage them to rediscover their faith, and that can provide a source of comfort, stimulation, and reminiscence. And that's all we have for Alzheimer's dementia, and thank you.